Dr. Stevens, I've heard a lot of fear about the mRNA COVID-19 vaccine.
Yeah, and that makes sense. This fear is not new. Many people before us had to make similar decisions. When smallpox virus ran rampant, people had to decide to accept the side effects of a vaccine over a terrible disease. And unfortunately, that time has come again. While we see hundreds and thousands of people die of a disease even more disabled, we need to take a few minutes to talk about the side effects and the safety of the COVID-19 vaccine. So Elise, can you review what side effects people who participated in the vaccine trials had?
Yeah, absolutely. So people in these studies, they experienced fever, fatigue, headache, chills, body aches, and joint pain. Most of these symptoms were mild to moderate in severity and happened within the first 3 days after vaccination and then resolved in a day or two. This was actually more common after the second dose, and people who are above the age of 55 were less likely to have those side effects.
And that makes complete sense because these effects are really your immune system responding, not the vaccine itself. So if you get these side effects, it means that the vaccine is working. Just like when you were to go to the gym and your muscle feels sore, it means that you've exercised well. The same thing. With side effects from the vaccine, it's your immune system's way of working out. But Elise, there's a lot of questions about safety as well. Can you look at the clinical trial?
Yeah, absolutely. So between the two mRNA vaccines, there were 70,000 people that participated in the vaccine trials, and of those, about half actually received the vaccination. So there is a lot of safety data. However, rare side effects that can happen in 1 in a million people, for example, are only going to be found once more people get the vaccine. So it's true that we don't yet know about super rare side effects that may occur with this vaccine until it's given to more people. But that's the case with any vaccine. We usually know most about bad side effects within the first 6 weeks after it's been given.
And that's true. Like anything in medicine, our knowledge 15 years from now is going to be very different than now. So we are going to continue to learn. And there is a program, a nationwide reporting system for any side effects during when people get these vaccines. There's a new text and web-based program the CDC is calling vSafe to monitor vaccine safety and look for rare symptoms. This will check in with people who have gotten the vaccine at regular intervals to monitor side effects. It will check in daily for the first week and then weekly for the first 6 weeks, then again at 3, 6, and 12 months after getting the vaccine. It will also remind you when it's time for your next dose. It's rare to get a side effect from a vaccine years later, and very few vaccines have ever been pulled off the market.
And so we don't have 10 years worth of information on this vaccine. That's true, and there's no way around that. We do, however, have a full year of information on COVID-19 and how deadly it is and how much damage it's doing to our communities. And the long-term risks of the vaccine are all theoretical. The risk of getting COVID and letting it spread in our communities is very real right now. We understand that the decision to get vaccinated is very personal, and if you have further questions about your specific situation, please reach out to your healthcare provider.